Hello everyone. I hope you all are doing good. I'm Sumitra. I'll just give a little introduction of myself. I am doing a 200 hours yoga teachers training program with Yoga Alliance. And I've also learned yoga and asanas for several years now. But today's lesson is going to be a little different than the usual yoga postures. It's going to be more theoretical today. And I have just got back from my native country and I've self-quarantined myself in this bedroom. So I sit on the bed and I've been doing all my work the whole day, like working on my laptop, filling up my yoga journals and reading books. Now, at the end of a second day, I suddenly felt a pinch on my shoulder. So I just jumped off the bed and then I saw that my entire neck and shoulder was stiff and tight. I could literally feel the lumps, these little bumpy things on the shoulders and knots, which were extremely tight. Good that I knew a lot of stretches, neck and shoulder stretches, so I worked on it and then I was fine. So what I realized is that coming out of that repetitive forward movement actually helped me. So then I realized that there are a lot of people nowadays who are complaining of neck and shoulder pain. So these typical complaints are actually tightness, stiffness, and this muscle spasms. And then people also say that they don't get good sleep. Okay, so these things can happen due to certain reasons. Now we need to understand what is the cause of these kind of muscle spasms or tightness or stiffness. Now, the weight of an average human head is 13 pounds. So we are carrying a 13-pound weight on our body. But do you think our neck and shoulder are good enough to hold that? It is actually not. Every other person who complains of shoulder or neck pain has to work on it to actually carry the head. The mind is inside the head, and the mind is responsible for emotional imbalances. So such things actually not only cause physical imbalances but also emotional imbalances. So now this can be caused due to few things that I kind of thought would be good to share with you. Any kind of a repetitive forward movement, holding head in one position, sprains, and very inappropriate way of sitting, like slouching on the chair or the sofa and not sitting straight, or inappropriate posture of sleeping. Now, there are other things as well, like overexerting ourselves, overworking, overdoing things. That can be work at the office, or when we bring work home, it can be that, or any kind of work inside the house, like bending down and doing mopping and sweeping. So any kind of repetitive movement can cause the muscle stiffness and tightness or the spasms. Now, what we're going to do today is get into a little bit of preliminary treatment of the neck and the shoulder at home, and also learn some acupressure points that we can massage on at home ourselves. And then at the end, I'm going to talk about certain asanas or yoga postures that we can do every day maybe like as soon as we get up from the bed, just take 10 minutes to do a few postures, and that'll keep you up and running for the entire day. So now that we know the symptoms and the reasons what causes the neck and the shoulder pains, let's get into a little bit of the anatomy of the spine. Today I have here with me Mr. Skeleton. He has actually been helping me a lot in my yoga teaching program. He has mostly all the bones in the body, but there's no flesh and muscles. But today we're going to just work with bones. So let's see. Now here is the spine. The spine starts from the base of the skull and goes all the way till the pelvic area. And this end, the end of the bone, is called the tailbone. Now the spine has a lot of sections. We don't need to really go into all the sections, but we can just talk about 5 sections at this moment. One is the cervical spine, which is like C1 to C7. One is the thoracic spine, which is right behind the chest. It's right behind the chest, which is like from a T1 to T12. And the L1 to L5 is the lumbar spine, which is right behind our belly and lower abdomen. Now, when we talk about this C1 and L1 and T1, what does that mean? That means the vertebrae. The entire spine is made up of small pieces of bones, which are called vertebrae. The vertebrae have little discs going in between them, little discs, lubricating ligaments running in between the vertebrae. They are circular ones, they look like discs, okay? Now that disc provides mobility to the spine, to the entire spine. So now you can realize that how complicated this bone is and how much treatment or how much care this needs in our daily life. This spinal cord is an interconnected complex of bones, muscles, tendons, ligaments, and nerves. So there are a lot of nerves also running through this spinal cord. And the neck particularly, the cervical spine, it is a passage key to a lot of arteries and veins, including the lymphatic, the musculoskeletal, and the endocrine system. So you can now know how important this part of the spine is. So we need to constantly keep working on this part so that it helps us to bear the entire weight of the head on the spine. Now, in our daily life, we have a lot of tensions and stress, and that all that comes from the mind, right? So everything generates inside the brain, and then the reactions go further down the spinal cord. So now that we understand the anatomy of the spine, we need to know how to take care of this neck and the shoulder. Now we can bid goodbye to Mr. Skeleton. Let's now get into some preliminary treatments of neck and shoulder pain. The foremost thing, the foremost thing that we need to do is apply some heat compression. And we can also take some non-steroidal painkillers that is available over the counter. Do some trigger point massage therapy. So you need to just identify the spots where you have the pain and the spasms, and then just work on it with your hand, with your fingers. Use the strongest finger, either the thumb or the middle finger, and just keep massaging those trigger points. So that will relieve you of that pain. Now, I have noticed that this neck and shoulder pain is very common amongst people, mostly between 40 and 50. But nowadays, even teenagers and college goers are complaining of neck and shoulder pain because there's a lot of usage of phones, tabs, laptops, because our screen times have gone up. So what is happening is that there is a repetitive forward movement of our neck and shoulder that is causing all this problem to happen. All the stiffness, the tightness, and the muscle spasms, and sometimes there can be numbness and tingling that can come down all the way from the shoulder to your hands. Now we got to be very, very careful. The preliminary treatments can be done at home, but if the pain still persists with the non-steroidal medications, you may have to take some corticosteroid injections, and that has to be consulted by a doctor. So please don't wait for a long time for the situation to deteriorate further. But after you are done with the preliminary treatments and things don't work out, things don't get better, please see a doctor or a therapist. Now we are going to get into some of the home remedies we can do. Acupressure. Acupressure is something that is very simple to do, and you can always do it at home and any time of the day. I would always suggest that you do it multiple times during the day, like first thing in the morning when you get up from bed, maybe late in the afternoon or early evening, and the last one can be before you go to bed. Now let's talk about some of these acupressure points that you can work on by yourself at home. I have marked some points on my hand. If you notice, here is a point right here. This is this fleshy part between the index finger and the thumb. And I have marked it with a marker. So what we can do is we can take the middle finger and the thumb of the other hand and go in there and press it down like this. Or keep massaging in a circular motion. Now do it for 20 to 30 seconds, release, and then go back and do it again, release, and then go back again to do it a third or fourth time. Now this has to be done multiple times during the day. So just do a set of 3 or 4 counts and then just repeat that multiple times during the day. Now let's go to another point, which is actually called the Union Valley point. That's very it's the fleshy region in between the thumb and the forefinger, okay? The one that I just talked about. So this is called the Union Valley point. Just remember that. This is the Union Valley point. Now there's another fleshy point inside the palm. This is called the Hand Valley point. It is in between the index finger and the thumb. If you look, I have put a small mark here. So take And again, take your thumb and your middle finger, go in there and keep massaging. Okay. See, the thing is that if you massage this particular point, both the sides work together. So you don't need to work them separately. You can work them together. These points are exactly opposite to each other, as if it's like a mirror in between and it's just a reflection of the other. Okay, so just keep massaging your hand valley point and the union point. Now let's go into some more of the points. There is a point, as you can see, I've marked in line in between the pinky and the ring finger. This is a point. So just take a pen head, or if you have any instrument that is used in acupressure, I would highly recommend to use that, the head of that instrument, and go in there and just go on applying a pressure in a circular motion. The next point is in between the middle finger and the index finger. This is in line with just the middle and index finger. So again, take the pen head or any instrument that is used for an acupressure and take the head of the instrument and massage it down in a circular motion, or just hold it down. Okay, you need a strong hand, believe me, to apply the pressures on this. Okay, couple of more points. If you notice, I have marked on the side of my pinky. This is a point where the pinky ends and the what do you say, the palm, the flat portion of the palm starts. Actually, is a joint. So you can go in there and massage. And there's, if you just come down 1 inch, there's another point here which you can massage with the pen head or the head of an acupressure instrument. Now we're going to go to the heart point. If you notice here, I have a mark here, a little mark. This is called the heart point. This is in line with the ring finger and the pinky. If you come straight down, you will see there's a little dip here. So just take your pen head or your acupressure instrument and keep on massaging in a circular motion. So I'm sure this will definitely help you at home. This is something very easy to do, and if you work on it every day, multiple times, this will definitely keep your pain under control. And I'm going to show you some more acupressure points that are on our neck and shoulder. Now here is our earlobe, and behind the earlobe, exactly where the skull ends, you will see a little dip. So here is one point that you can always work on. I can point it out with a marker. Here's one point. Okay. If you come down further, here is another point that you can work on. You come down further, here is another point you can work on. And if you come down even further, here is another point that you can work on. This is called the shoulder valley. If you feel this area, you will see that there's a little lump over there. So just go on that lump and keep massaging with the pen head or your acupressure instrument in a circular motion till the pain subsides. Now, what I usually suggest is that there is a particular way of putting your hands together. If you just touch your hands together like this and go behind your neck with your thumb, then you will be able to touch the first point. This is the first point behind the earlobe. So you can massage this. There are 2 points on either side of the spine. Keep massaging these two in a circular motion. Come further down. Keep massaging this portion. And then you come further down and you can keep massaging the joint of the neck and the shoulder. Now, the shoulder valley, this point obviously has to be done with your finger. So you can take your index finger and middle finger and go in there and just keep pressing it down and making a circular motion with your fingers. So these are the points, the acupressure points on hands, neck and shoulder that you can always work on at home every day, multiple times. I know it is kind of boring to get into exercises and stuff like that. We generally don't like it, but just to avoid, you know, the problem, the issue that has been occurring frequently, and you know, it's nagging. So just to get relieved of those pain, you can always try these acupressures, massages at home. And now I'm going to show you some asanas or some yoga postures that you can do every day to just relieve your neck and shoulder pains. Okay, the first yoga posture I'm going to show you is going to be a forward fold. Keep about a foot gap in between your feet, about 12 inches gap in between your feet. With an inhalation, raise your hand up, and as you exhale, you drop down with your hands planted on the floor or holding the shin, but your head dropping down and your crown chakra facing the floor. This way you can relieve all your tensions and stresses. Whatever is there on the shoulder and neck, everything will get relieved through your head and go with the gravity. So just drop your head and just enjoy this stretch in your body and enjoy the bliss. Come up slowly, one vertebrae at a time, and the head is going to be the last one to come up. Now I'm going to show you another posture which is very similar to this one. It's called the downward facing dog. This is called a downward facing dog, where you have another 12 inches gap in between your feet. Your toes, balls of the feet and heel, everything has to be grounded on the floor. Hands planted on the floor, head dropping down, and your crown chakra facing the floor. Beautiful. Just enjoy the stretch on your entire body, on your cervical spine. The tension, the stress, everything gets relieved. Let it go. Just let it go. I'll raise my head and walk up to my hands to show you the next posture. Now, we can also get into a puppy pose from the downward facing dog. When you are in a downward facing dog, you just bring your elbows down and your head up. Feel the lovely stretch on your neck and your shoulder. It's called a puppy pose. And now we are going to go to a child pose. Make sure your hips are on your heels. You can leave some gap in between your legs or keep them together. And inhale, raise your hands above your head. And as you exhale, you just drop down on the floor. Let your head touch the floor. Your third eye chakra touching the floor. Just let it go. Relax. There's no tension, no stress. Just let it go. From here, we are going to come into a tabletop position. This is called a tabletop position. Make sure your hands are right underneath your shoulders and your legs are at a 90 degree to the floor. We're going to do some cat and cow positions. As I inhale, I curl in my spine, raise my head up. Oh, this feels wonderful. As you exhale, you curl your spine out and your head inside. Inhale. And exhale. This is a cat position. Inhale. This is a cow position. And exhale to a cat. And now we are going to go down on our heels again. Raise one hand up and bring it, twist it and bring it underneath the other hand towards the other side into a thread and needle posture. Let your head fall on the floor. Rise up, raise your other hand and swing it over to the other side with head dropping on the floor. This is called a thread and needle posture. Now I'm going to show you some sitting postures. Fold one leg on top of the other so that the knees are in line, and use your hand and just twist to the side. Twist to the other side as well. Make sure one hand is on the knee, the other hand is planted on the floor, and you turn your body to the right, facing backwards. We can do this one more time. Make sure your hand is on the knee and the other hand is planted at the back, and you turn your body overlooking your shoulders. We can do this one more time. Feel the lovely stretch on your neck. Your neck and shoulder relaxes. Just let go of any tension and stress. So I'm hoping that these few asanas and acupressure point therapies can help a lot of you to relieve your muscle spasms and the stiffness and tightness that you're having from neck and shoulder issues. And make sure that you are not in a repetitive movement for a very long time. If you know that you have to sit for 6 hours, take break every 1 hour. If you know that you are going to do an activity that is going to take say 7 hours, just take a break from it every 1 hour. Do a little bit of stretchings and then go back to your work. And And then I'll also show you some very simple stretchings that has helped me, like just bring your head down from one side, keep pulling your head down till you actually feel the stretch on your neck and shoulder. Inhale, come up. Use the other hand. Inhale, and as you exhale, pull your head towards the shoulder so that the ear touches the shoulder and you feel that wonderful stretch right here. Okay. And there is another simple exercise that I can show you, is just raise your hand and turn it to the other side of the head. Make sure your upper arm is touching the ear, and with the other hand keep pushing the elbow down like this. Release it. Use your other hand, bend it behind you. Take your other hand and push it down right at the elbow. You will feel the lovely stretch like here. And this is the one last one that I want to show you, is take your hands back, interlock them, and squeeze in your shoulder blades to get a beautiful stretch. And release it. Take some few normal breaths here. Breathe in, side out. Breathe in, side out. Some normal breathing. I hope this video helps you guys, and I'll be looking forward to some reviews and a lot of subscriptions. And I would like to thank you all here for today for this practice, and namaste.